One of the things with multiple myeloma that makes it so challenging is it's a very complex disease, and so it's very heterogeneous in nature. If your treatment room was full of myeloma patients, they could all have a different type of myeloma and present it in a different way. We're fortunate that most myeloma patients have what they call standard risk or intermediate risk cytogenetics, but there are some myeloma patients that fall into this higher risk category, and their disease is much more aggressive in nature. So I think that's one of the complicated things, is understanding which ones of those patients are going to have that more aggressive course and which ones we expect to see a more indolent course. It can make a huge difference in how we're treating them and taking care of them over the course of their disease. And I think from a nursing standpoint, that can be frustrating because sometimes we expect people to do really well for a long time and then they don't, and why is that? So I think a lot of the research today is thinking about that, how we can get better at determining which patients are going to do better in planning their therapy, if that makes sense. And then side effect profiles from the disease itself, a lot of pain. That's challenging to manage this disease. One of the classic symptoms is bone lesions, so pathologic fractures, back pain, common complaints that this patient population has. So right out of the gate, we have to deal with this whole other side effect profile from the disease itself. So that can definitely be a challenge.